Morning, ladies and gentlemen. This is Andrea Marie A. Bujeron, an OIC Administrative Officer to Negros Occidental Comprehensive Health Program. I would like to present to you today my study about implementation, challenges, and best practices of the mental health strategies in municipalities of Negros Occidental. For the objectives of the study, it can be used as baseline for the local government units to review their mental health programs. Encourage local government units to develop strategies in the implementation of mental health programs. Urge the local government units to enhance existing mental health programs and press on the local government units to carry on with the possessed best practices. For the methodology, the researcher employed a descriptive methodology with a quantitative research design. 90 respondents were purposely chosen as they are responsible for the implementation of mental health strategies in three congressional districts. A researcher-made questionnaire was used based on the mental health program model created by Civil Service Commission under Memorandum Circular Number 4, Series of 2020, which is composed of three parts. A pilot testing was done with 30 volunteers from various municipalities in Negros Occidental who are not involved in the actual data collection, and descriptive methods were used to evaluate quantitative data. For the summary of the findings, Problem 1, the extent of implementation of mental health strategies resulted to poor extent. Problem 2, challenges in implementation of mental health strategies resulted to top three identified challenges. First, lack of formally trained mental health experts that scored at 86.7%. Lack of mental health facilities, 86.7%, and lack of financial resources, 78.9%. Problem 3, the best practice. Common to all LGUs is prevention, promotion, and information and education campaign on mental health, which is understandable because our mental health law was just recently enacted in the year 2018. For the conclusions, delay in the implementation of the mental health law and mental health strategies is a violation of the basic right of every Filipino to mental health services and will aggravate the stigma and discrimination of people with mental health conditions. Government should exert all efforts to adopt plans and programs to promote efficient and effective implementation of mental health services. Challenges encountered should be addressed at the soonest possible time to avoid further distress to people already suffering from the lingering pandemic of the COVID-19 and the increasing climate change that affects the environment. However, there are best practices, but the implementation of these practices is limited. Best practices identified should be encouraged to continue and be shared to neighboring localities for an inclusive development in mental health programs in the province. For the recommendations, LGUs may formulate policies and implement mental health strategies in response to the challenges identified in this study. Mental health care providers may prepare annual action plans for implementation to facilitate the strict enforcement of the mental health law or the local ordinances pertaining to mental health. Provincial government may pass legislations to enhance the mental health programs, incorporating mental health strategies that are economical, efficient, and effective for the benefit of all government employees and general public as a whole. For the impact or outcomes of the study, in response to the findings of the study, the researcher is proposing a strategic plan to enhance the implementation of the mental health strategies that may be used by the local government units that will result to the following success indicators. integrated mental health initiatives and advocacies into the policies and programs of LGUs, strengthened implementation of the mental health law, a well-developed, comprehensive, and efficient health plan in the LGUs, and strengthened local leadership and governance for mental health through formulation of policies for mental advocacies and psychosocial activities. For the original value of the paper, the findings of this study may be used by the local chief executives and the municipalities in Negros Occidental as inputs in the formulation of programs on mental health services and advocacies on mental health care. The findings may also be utilized by mental health care providers in the preparation of action plans to provide the best approaches to implementing the mental health program as well as guide the provincial government in enhancing its mental health program. And future researchers may also use the findings to investigate the mental health law's thorough implementation. Here are the references that are very useful in this study. Thank you for listening.